my background, my father's side of the family is actually Italian, and I had a serious problem with hair. That's why I do this.
Oh, really?
So and my hair growth is genetic, was genetic, not an endocrine dysfunction, which you know everyone's different, and people come to see us with genetic hair growth or hormonal hair growth, or again with the folliculitis or a skin condition that the hair is either causing or irritating for them. So there's so many aspects of what we do to help people.
Right. This is fascinating.
We're mammals.
Yes.
We're covered with hair.
Yes. And we have pores and then
And sometimes, not just for cosmetic reasons, but a lot of times for cosmetic reasons. Sure. We want to look good, we want to feel good, so we want that hair to be removed. But for medical reasons as well, the hair should and needs to be removed for certain people. Right. Sure, we want to educate people, let them know that this option is available to them. There are other things out there besides conventional electrolysis and laser, which a lot of patients are not candidates to have laser done, whether it's their skin color or their hair color. Or the area that they want to have treated. So this procedure is another option for them.
This is a win-win situation.
It is, and we are very busy.
Oh, good.
And it's wonderful, but again, we do want to educate people and let them know the field's been saturated with laser. Unfortunately, when laser came out back in '97, it's 10, 11 years now, all of the schools that taught the procedure, they shut down, basically.
Really?
So, there aren't qualified technicians. There are just not enough qualified technicians to treat all of the patients that need the procedure done. So I started the apprenticeship program through California Board of Cosmetology. And we had the very first electrology apprentice for electrolysis in California, and has been licensed. So that's a wonderful accomplishment for us. So we're working with Division of Apprenticeship Standards and the Department of Education and Superintendent of Schools. So it's
impressive.
Yes,
yeah,
it's wonderful. It's wonderful
wonderful
because not only do we need to educate the public, but we also need to educate the technicians as well, and get more people doing the procedure, because we want to remove the hair permanently, but we want to remove the hair safely.
Right.
We don't want to damage skin. We don't want to cause burns or scars or hyperpigmentation. I mean, you can remove hair a lot of ways, but we want to do it the best way, the most effective, the most efficient, but safely. If you're going to damage your skin, leave the hair there.
Right. So do you get any celebrities up there?
All of it's confidential, obviously.
No, I'm not
we have
asking
patient
for names.
confidentiality. When I was in Beverly Hills, yes, we saw many celebrity
hairy people.
Celebrity hairy people, yes.
No, the trend,
hey, they're just people,
The trend in
everybody, exactly. Everybody needs to have hair removed.
And that's the trend in our culture, is to have less hair.
It's rare to find someone that doesn't remove some hair on their body,
whether it's men shaving their face or women shaving their legs. Shaving obviously is the quickest, easiest way to do it. But for permanency, this is it. This is just far superior to any procedure that's available.
Oh.
This is exciting. How
Doctor recommended and FDA approved for permanency. So, yeah, and it's been around for a century.
Have there been any side effects with this technology?
That's a good question.
There are no side effects with this procedure. I mean, initially you will get a little bit of redness from the procedure. It subsides relatively quickly. In
a day or two?
Hours. Hours, okay. Yeah.
Okay.
Well, we have different things that the patient can apply to the area after treatment, whether it's cortisone or aloe or tea tree or something just real soothing and medicinal.
Why is that? Is it from the heat of the...
It's a histaminic reaction, exactly. So it'll be like a little hive or a mosquito bite. So if you're getting a lot of hair done in a small sensitive area, say the upper lip, for example, it's going to be a little red.
Sure.
But again, it subsides very quickly. And it depends on the patient. You know, some of the patients are hypersensitive, so they will have a reaction for a little bit longer, and someone else, you know, they walk out of the office and it looks like they've had nothing done. So everyone is different.
Do you recommend a cream for it, or do you sell a cream, or do you send a client home with the cream?
Again, you know, whatever's going to be healing and medicinal, everyone's different, so we have different things that the patient can apply. Cortisone, Benadryl gel, aloe is great, tea tree is great, arnica. You know, if they want to use something more natural, an organic product, that's fine as well. Yeah, so anything that's going to be soothing and medicinal. And when the patient comes in, we go over all of the skincare, pre and post things that they shouldn't do for the treatment.
I have to say that probably there is a couple of cultures that are probably a little more defining, as you mentioned. You know, the Italians, the Latins were known to carry a stronger.
Absolutely.
Yeah.
There's some Middle Eastern
Yes.
cultures. They do, it's called threading. I don't know if you're familiar
Yes,
with
I've
that.
heard of that. Yeah.
They
the eyebrows,
remove it's pulling, but they pull the hair out with thread or pieces of string or silk. Very interesting.
Yeah.
But yeah, I mean, it dates back to forever.
Yeah, antiquity. Yeah. Well, it's a fascinating topic. Even though I was thinking this morning, how am I going to embrace this, or because I know from my experience with hair, I have the issues that I mentioned before with my ears, and you're right that the older a man gets, you know, the hairs in the nose.
It starts coming out.
Yeah.
But it also affects everyone, men, women, in different areas, or people know people that they,
And
you
of
know.
all ages.
Right, all
I
ages.
have mothers bringing their sons and daughters in at puberty, you know, so 13, 14, 15. The girls, when they start to menstruate, generally, you know, they go to their mother, or they take it upon themselves and they just start tweezing, which is, a lot of times you want to avoid that, because I love getting them when they're young, because then they don't have to suffer the way we did. They get to enjoy it for a lifetime.
All right. So the idea, Cheryl, is for people to understand that this is an art form. Number one. Number two, I think it's health-wise, I think it's fabulous because it makes you feel good, and everybody that feels good is usually a healthier person, because there's nothing like feeling good to portray health.
Yay.
And the other thing that I'm looking at to say about your field is that you have to get the people that know what they're doing.
It's so important.
So it's everything, because like our field, if they don't get the people, they're going to find themselves calling us eventually.
We specialize. We're experts in the field, what we do. That's why we do one thing and we do it the best we can. I work with the doctors, and if I have a patient that comes in, that I refer them to the specialist, whether it's an endocrinologist, a dermatologist, if they just want skin care, massage, manicure, whatever their needs are. I do hair removal. That's what I do.
Right.
Everything else I refer.
Okay.
And I try to find the best of the best to do that.
Well, Cheryl, it was a pleasure having you on.
Thank
Really,
you.
seriously.
Thanks for having me.
Oh, my pleasure.
It's been fun.
Yeah.
To hairfree4ever.net is the website, all the information there. We are located inside Pure Skin Wellness Spa in Ventura, and 805-644-3900.
Thank you.